Hi, I'm Lisa Mayo from Lane Cove Podiatry. We've been talking about heel pain recently, and kids' heel pain can be very different to adults' heel pain. When children get heel pain, it's often an irritation of the growth plate of the heel area. We typically see it in kids aged between about 9 and 15 years of age, and it's often children that have been involved in a sporting activity, or they've got a lot of sports that are actually pushing their tolerance level over their thresholds, so they experience pain. And what an irritation to a growth plate means is that in the heel, we look at the area where the Achilles tendon joins onto the heel and the calcaneus, and in this area, the heel growth plate is starting to ossify. Now, what that means is that different parts of our body ossify at different parts during our growth time. In the foot, there's lots of little bones, and some of them will ossify and become completely bone as 3-year-olds. So the navicular is one of those bones on the inside border of the foot. But the heel starts to completely ossify between the ages of 9 and 15. So when you visualise a growth plate, I like to think of it as a little bit like a ham sandwich. So we've got the bit of bone on the outside where the Achilles tendon comes in as being one part of the sandwich. Then in the middle is the piece of ham or the cartilage that's still waiting to ossify. And on the other side is the other part of the sandwich, which is the other part of the heel bone. And what's trying to happen over that period of time is that those two bits of bread or sandwich are trying to move across and migrate through the piece of ham. So it's a funny concept, but it's easy to visualize it in that way. And when you think about the Achilles tendon, it's pulling on one side of it. And so there's a lot of torsional or tensile stretching on that area. So for children that are involved in a lot of sport and they've got a lot of landing elements going on, there can be an irritation to that area. So they typically present with heel pain that's intermittent. They might wake up and they have no heel pain. They might be playing their sport and they start to limp during their sport, and then they have exquisite pain at the end, and then no pain again. So it's one of those things that come and go. So it's very insidious until it gets to the point where it's bothering them a lot of the time when they're active. So ways that you can help and manage your child with heel pain is, first of all, to listen. Notice what age they are, looking at using a really well balanced and stable pair of shoes, and preferably wearing a good quality athletic shoe a lot of the time. That's going to give them more support and cushioning. If their heel pain is persisting, make sure that they ice after their sport, and they can start some gentle stretching exercises of their Achilles. If, however, their heel pain is persisting, it may well be that the actual mechanics and how their foot is working is faulty, and they need that extra bit of assistance. That's where podiatrists can be involved, and we will help you diagnose what the pain is, but also look at ways at managing how their foot's functioning so there's less stressors on that area. It's really important that our children are involved in sport and we keep them playing their sport. So if heel pain is affecting your child, affecting their enjoyment of their sport, please seek assistance and get them treated so that they continue playing their sport and having fun on the weekends and during the week. Thanks very much, and please help your child manage their heel pain.